When was the last time you looked at your hands closely and saw symptoms that might indicate a disease? Seeing cold in your hand, feeling numbness, maybe seeing them with a dry skin, sweaty hands, pain or stiffness, joint pain, maybe even paleness or changing in color. All of these could mean that you might have a certain health condition, a disease that you might have now, or that it's trying to show up and you still can reverse it if you know how to recognize what your hands are trying to tell you. What can you see in your hands? What do your hands indicate about your health? And how can you reverse this? That's what I'm going to reveal to you in today's video. Not many people understand that the distant part of our bodies, our hands and feet, could be one of the first to show symptoms of a condition that is now present or is trying to creep up its way in order to show itself in our bodies. Maybe diabetes, Raynaud's syndrome, autoimmune conditions, arthritis, thyroid problems, hormone problems, all sorts of metabolic conditions and chronic diseases that you could recognize today before it's too late. If you're seeing any of the symptoms I mentioned in the beginning of the video, these actually mean something, and they mean something for you to take action. Take action for these diseases not to appear. Number 1, cold hands and poor circulation. If you're seeing that your hands are always cold, they may even be slightly sweaty or sweaty with that cold touch to it, if you know what I'm meaning. This could mean that there is not enough circulation, maybe one. Your thyroid is not working because there's not enough metabolic rate to produce the energy in order for your hands to stay hot, and you could have a very complicated immune condition called Raynaud's syndrome. Now, Raynaud's disease or Raynaud's syndrome is basically something that you don't see as often, but you can also see in your hands that frequently show up when you are feeling stressed, when you're feeling that something is not adequate to where you are living. Maybe you're feeling cold, too cold in your hands, and you're seeing all this paleness in your fingers. And if you're not quite seeing the way I'm showing you in these pictures, you might have a thyroid condition or poor circulation. If you're feeling cold in your hands, something is wrong. You shouldn't be feeling cold. You should be feeling just normal or maybe even warm, but not in a condition where you feel constantly that your hands are always feeling cold or you're feeling that something is not right. If this is something you're going through, you have to activate your metabolic rate, improve thyroid health, take supplements like Metathyroid from Fineland, CarQ Health, melatonin or 5-HTP. All of these will help with any of the conditions I've just mentioned to you right now. Number 2, seeing that your hands shake is not normal. If you extend your hand and you're seeing that your hand is trembling, maybe not seeing it stay stiff like you see right now with my hand, there might be something going on. It might be anxiety. It could be a caffeine or coffee you took maybe an hour before, but it also could mean that you're seeing a start of also something bigger, something more serious like Parkinson or a neurological condition or even nerve damage. This could mean that you need treatment. And in a case, I would tell you to go to the doctor, have a good diagnosis, make yourself available to get a checkout, to get a physical, see if something is wrong with the functioning of why you can't keep your hands still. This could mean something, and it's good for you to reverse it or take care of it now before it gets too late in the future or in the long run. If you need something natural, maybe look for Neuroflex, Neuromatrix, on cardio, and 5-HTP or melatonin from Fineland at finelandvitamins.com. Number 3, stiffness or pain when you have a physical activity on your hands. If you're waking up every morning and you're feeling that your hands are stiff, you can't move them, and then they just get better as the hours go by and you have some physical activity starting to pump your body into action, well, this could mean this is arthritis. Arthritis is actually symmetrical. You will feel that pain and stiffness in both hands, not one. If you feel it in one, there's something different. It might be osteoarthritis, which is the degeneration of your joints, but it doesn't happen symmetrically. Arthritis happens symmetrically, and if you're seeing any of these in these conditions, it could mean that you have an arthritis condition or an osteoarthritis, which needs to be treated before your joints degenerate. They maybe change their form, or you start seeing pain that is just tolerable. In any case, it's a good idea to stay off of any breads, any gluten, any red meat, sausages, processed meats, too much salt. All this affects arthritis, makes it worse, and it obviously makes it a lot harder for you to eliminate or reverse it if it's starting right now. Some of the anti-inflammatory supplements you might want to look for are CurQ Health, Neuromatrix, melatonin, and Extra Flex, which will all help with that inflammation, reducing it, taking away the pain, and if you take it for a very long time, maybe even reverse it and not see it ever again. Number 4, paleness on your fingers or your nails. Your nails in your finger are going to show the color of what's within. If you have enough blood, if you have enough red blood cells, you're going to see that your hands actually have color. If you see them pale, your nails are completely pale or not pink at all, this might be a symptom of anemia. And sometimes people think that anemia is not a health condition that has to be considered. It's actually pretty harsh on the body because your blood is the one that's going to feed every single cell, every single tissue, every single organ. And if you do not have enough red blood cells, well, you're not receiving oxygen, you're not receiving nutrients, and every single cell in your body is suffering the consequences. Get this fixed. Start eating red meats and stop paying attention to people that tell you that red meats are not healthy. They're actually really healthy if you eat grass-fed meat. Very healthy. You need this. You need this in order to make blood. You need maybe liver, beef liver, you need spinach, and you need supplements sometimes like B complex, B vitamins, iron, all of these to help you build that blood that you are looking for. Something like B max, something like B12 Forte, or Red A Plus from Fineland at finelandvitamins.com. Number 5, numbness and tingling sensations on your hands. Any of the symptoms I mentioned before have nothing to do with nerve damage, apart from Parkinson's. But your hands can actually are the first ones to see something like a neuropathy. Neuropathy is nerve damage due to sometimes maybe chemotherapy, but most commonly due to metabolic problems like obesity, diabetes, problems with insulin resistance, poor thyroid function, and all of these will cause nerve damage. You'll see pain on your hands, you will see numbness, you won't feel maybe some things that you should be feeling and you know that something is wrong. This could mean that your nerves are dying off. They're not functioning properly and you're seeing a diabetic neuropathy or a neuropathy that is actually going to get worse with time if you don't treat it right now. Start exercising. Start making sure your thyroid is working. Make sure you're lowering your blood glucose and take a supplement. Take a supplement specifically for this purpose because nothing in the medical world will actually help you unless you do it naturally. Something like Neuromatrix, Neuroflex, Berberine, Appleizer, all these will help repair your nerve damage and at the same time fix something that might not be working with that glucose metabolism, that thyroid function, and everything I've just mentioned. This is actually very, very crucial. And if you're seeing this nerve damage on your hands or maybe on your feet or other parts of your body, it could mean that you are on your way to diabetes or you're actually now a diabetic patient and you still don't know that you are. Don't forget to give this video a like button, don't forget to share, and don't forget that your hands can reveal a lot about you. And I forgot to mention, maybe even feeling your hands that are sweaty or dry could mean a thyroid condition. That's something I forgot to mention. Don't forget to give this a like button, don't forget to share, and I'll see you in the next video. Take care.